Hi, I'm Dan Lucas, and I work for Regions Blue Cross Blue Shield. And first off, I wanted to say that I've been hearing at work ad nauseum for the last 3 or 4 years most of what Russ had up on the slides there. In fact, we get grilled every once in a while on making sure we know these things, so I have them on the back of my little security badge. So I can cheat in telephone calls. I got involved in this. I'm not a spokesperson for Regions Blue Cross Blue Shield. I'm the last person you want. I work in the computer department. But I got involved because I started hearing, I heard Nancy Pelosi, I heard the president, I heard Representative Wu vilifying health insurance companies and talking about the obscene profits and how that's causing healthcare to be so expensive. And the one that really got me was I saw on Representative Wu's website, he said that health insurance companies care more about profits than people. Well, Regions is nonprofit. And I did a little bit of research, and the top 3 health insurance companies in Oregon are nonprofit. And I got to looking, and nationwide, more than 60% of all health insurance companies are nonprofit. How many people knew that? So, and of the health insurance companies that do make a profit, they make an average profit of 2.2%. The number I hear a lot is 35%. And if somebody knows where I can make that, I'd like to know. But, and even my wife and I went to Representative Wu's town hall meeting at Good Samaritan, and somebody outside was quoting the 35%, and somebody inside was quoting the 35%, and I found on an AFL-CIO blog, 35%. It's a made-up number. Most health insurance companies are nonprofit. No shareholders, no owners. And the ones that do make a profit, they make an average profit of 2.2%. So that's the first thing that got me mad and got me involved in this. And then, of course, several people have asked, well, did your company put you up to this? And of course, the company would be crazy to put somebody from IT out there. But we did see lots of examples at, but I want to go back up a second. Representative Wu, he told a little story there. He said, somebody asked him, well, you know, if this legislation passes, will you go on this? And he said, well, no. He said, I'm on a government plan, and I like Kaiser, he said, but my wife likes Blue Cross Blue Shield, and of course, so they have Blue Cross Blue Shield. And then he's standing in Good Samaritan, which is owned by Legacy. So for the last several years, Representative Wu has had nonprofit health insurance, and he's standing in a nonprofit healthcare provider, but apparently he doesn't know this. And it bothered me that Pelosi and Representative Wu and these people are making huge legal changes to our healthcare system, thousands of pages, and they don't know something that basic. It makes me wonder what else they don't know about this. So as far as grassroots, we're sitting there in line. I'm a rocket scientist. I thought I could get there about 1:45. You know, the town hall was at 10. I thought, we'll get there about 1:45. We'll get in. And my wife says, you're clueless. She's been watching the news, and she said, we got to get there at least 2 hours early. So we did, and we just barely made it in. They let 60 people in. And while we're sitting there in line, I looked up and down the line, and there's lots of people holding little handmade signs. And almost all those little handmade signs were against the current legislation that's being pushed on people. And then they had these people walking up and down the line with very expensive, pre-printed, nice signs from places like Healthcare for America Now, which is related to MoveOn.org, and they're handing them out to all these people to carry into the meeting, including to little children. And I thought, wow, and our side gets accused of being the AstroTurf. And my wife reminded me that there was this cute little girl sitting next to us, and people were handing out signs. Her mom wanted one of the signs, and the little girl got one of the signs. And one of the reporters from Pajamas TV came up and he asked the little girl, he said, well, why are you here? And she looked up and she goes, I don't know. She was there for a good reason. So I also started doing some other research once I found those things out, and I found that if we're going to insure the 47 million uninsured, and I recognize that number. Okay, it is 46.5 million. I didn't know there was a buzzer system. But the least expensive way to cover the 47 million uninsured is by using private health insurance, not the government. And I think someone else touched on this. President Obama got it right recently when he said UPS and FedEx are doing just fine. It's the post office that's always having the problems. Government health care costs a little over 3 times as much as private health insurance. Right now, government health care, which includes Medicare, Medicaid, VA, state plans, etc., is only covering 27% of all the people in the U.S., but it's so wasteful that it uses 46% of all the healthcare dollars to do that. And private health insurance is able to cover 68% of all the people in the U.S. with only 35% of the healthcare dollars. So, if we're going to cover 47 million uninsured, or 46.5, private health insurance would cost 188 billion, and the government would take 611 billion a year to do that. So, private health insurance, any way you look at it, is a lot more cost effective, and anybody who's ever worked with the government would understand that. So, thank you.